I recommend that women start getting an annual women's wellness exam, either at the onset of sexual activity or at 18, whichever comes first. Prior to that, they usually have been getting their yearly physical exams with their pediatrician or family practice doctor, but when they become sexually active or at 18, they need to start moving their to a women's wellness exam as opposed to a child well check. And that would include a full physical exam, a clinical breast exam, and then an STD check or any counseling for whatever health issues at that particular age. In their 20s, women should start getting, again, continue with their women's wellness exam, their once yearly exams, but at 21, they start getting pap smears. And the pap smear recommendations have changed. It used to be we did them at the onset of sexual activity or a couple of years after. Now it's 21 for all women. And depending on your risk factors, instead of doing them yearly, we actually only do them for some women every 3 to 5 years. But again, depends on their risk factors. And they still need, even if they're not getting yearly pap smears, that yearly physical exam with the clinical breast exam, the discussion with your physician about any issues that are pertinent to you, and just a full once-over check. In your 30s, again, we do some baseline labs, just your baseline health screening labs. Continue your pap smears every 3 to 5 years, any appropriate STD screening. Some women, based on family history, may start getting, other than just a yearly clinical breast exam, they may start getting mammograms or breast MRIs, again, depending on their family history. But 40 is the year where, along with the yearly physical exam, clinical breast exam, pap smears, health maintenance labs, and yearly mammograms, starting at 40. In their 50s, we add colonoscopies about every 10 years. And then when they are postmenopausal, we also add bone mineral density screening to screen for osteoporosis. But really, it should start at 18 that they get into that habit of a yearly physical exam, and then it changes as they age exactly what screening tests. But that's something to talk about with your doctor, is what's appropriate for you based on your particular health issues, your age, and your family history.